So today we're going to talk about round ligament pain. This is the most common complaint that I see with pregnant patients, and it typically starts second trimester. However, you can experience this pain from first trimester all the way to the third trimester. So basically what you're feeling is either sharp, dull, pretty sudden stabbing pain, kind of right into this area here, into the lower abdomen, into the groin, and it's typically with quick movement, and it's very short-lived. So most of the time you will feel it right as you're doing the movement, and it might last a few seconds and then be gone. So quick movements like getting in and out of bed, getting in and out of a chair, or when you cough and sneeze are the most likely the times that you're going to feel this discomfort. And so basically what happens is the round ligament is the supporting ligament of the uterus. So it is supposed to support the uterus, and then as it grows, as the uterus is growing with the baby, obviously that ligament is going to get stretched and it's more likely to get strained. Round ligament pain can be most prevalent throughout pregnancy just because of the imbalance and lack of motion or too much motion in the pelvis. So chiropractic care during pregnancy, even before pregnancy, is ideal, so we can make sure the pelvis is moving in alignment like we need to, so that surrounding ligaments and muscles are not going to get as strained, get as tight, and things like that. But when I do see a patient come in with round ligament pain, there are definitely some things that we can do in the office. Like I said, chiropractic adjustments to make sure that the pelvis is balanced and moving like it needs to. Self-releases, so I'll teach you how to kind of self-release the ligament, so when you are feeling the discomfort, and then different exercises and stretches that you can do at home, along with some of the muscle work and manual release that I will do at the office, and then we can get you feeling pretty good. Also, if it tends to be a lingering issue, the further along you get, if you're carrying really low or carrying really far out, we can use things like kinesio tape to kind of give support to that belly and take some of the pressure off that round ligament to kind of decrease some of the discomfort towards the end. Because stretching and straining of the round ligament is kind of inevitable during pregnancy, one of the big things that we focus on is the postural awareness. So I coach my patients how to be aware. Obviously, as the belly gets bigger, we tend to adjust our posture, but it's really important, especially if you are experiencing a lot of round ligament pain, to just be more aware of how we're holding our posture. So making sure we're keeping our chest stacked above our pelvis so that we're not overstretching that round ligament. And then when we're rolling over in bed, so some things that we can think of are, we want to avoid using our abdominals. So when we're rolling in and out of bed, rolling to one side and pushing ourselves up with our upper body to kind of leave our core out of it. And then when we're getting in and out of a chair, we can, pre-stretch the ligament. So we can kind of get on the edge of our chair, bring that affected side leg down and our chest back to just kind of gently pre-stretch that ligament. And then when we're getting ourselves up out of the chair, using our arms behind us to help guide us up. And then as well as when we're getting ready to cough and sneeze, simply bringing our chest or our knees closer to our chest can kind of take some pressure off of that ligament. So during the cough or sneeze, it's not getting that sudden stretch, which is when we get that discomfort. experiencing round ligament pain at any point throughout their pregnancy, I would love to help them. So give me a call at 513-463-3011.